Hi, my name is Dr. Spencer Zimmerman. What is chronic fatigue? If you're like me, you know many people who are suffering from chronic fatigue. So what is chronic fatigue and what could potentially be causing it? Now, it's such a widespread term that it's not, while it's technically a diagnosis, it doesn't really mean anything because it doesn't tell you anything other than I'm tired and I don't feel like really doing anything. It's just hard to make it through life. Now, this is one of the most common signs, though, that something is going wrong within the body. So the question is, what is going on in the body that's causing this? Now, there are some initial basic things that could cause fatigue that need to be ruled out. And then there are more serious things as well that could be really bad that should also be ruled out if it's not the other things. Don't initially think, though, if you've got chronic fatigue, the really bad is what you've got, because you may not have it, and you look at the more obvious stuff first and you progress from there. So what can cause chronic fatigue? An anemia. So an anemia is a decrease in the amount of red blood cells, as well as because they carry oxygen to tissue. So that can naturally make you tired. Now, anemia can be caused from a decrease in iron or in B vitamins. Those are two common factors that are needed to help make red blood cells. You could have a bleed somewhere as well that could cause anemia. Next, thyroid. Having a low thyroid can absolutely cause chronic fatigue. Specifically, if your thyroid has not been checked, as well as looking for an autoimmune disease to your thyroid. Next thing I commonly see is chronic infections. So chronic infections wear on the immune system, causing inflammation, and can cause chronic fatigue. The next one, gut health. Poor gut health can absolutely cause chronic fatigue. What most people don't know is about 80% of our immune system lives within our gut. So whenever our gut is unhealthy, it makes us inflamed. The more inflamed we are, the more tired we ultimately are going to be. And then the last thing I want to cover that I actually see commonly when patients come to me and say, hey, it's got to be my thyroid that I'm so tired. It's got to be my thyroid. It's got to be my thyroid. And I do a very thorough evaluation of their thyroid and it looks good. It's unresolved head injuries. Okay, I want to say that again. Unresolved head injuries. If everything looks fine, if you've been to different providers, whether they're functional or traditional, and no one's helping you, the brain is the most commonly ignored part in our entire health, but yet it's one of the most important things that should be evaluated. If your brain is unhealthy from a prior concussion, traumatic brain injury, whiplash injury, and so forth, you cannot have good energy. It's not possible. Your brain uses too much energy, and when it's not healthy, it puts you into more of an energy crisis than before, and it doesn't take much for you to feel bad. So that is what chronic fatigue is, as well as the different factors that can cause chronic fatigue. Now, that is not an all-inclusive list. There are many more factors, with some of the more ominous, which means more dangerous, but not necessarily likely. Cancer could also be a cause of that, as well as heart issues can cause fatigue as well.